are the cancer rates rising?
Younger people are being diagnosed with all types of cancer more frequently, unfortunately. We see it in colon cancer, we see it in genitourinary cancer, but we also see it in breast cancer, unfortunately.
Dr. Robyn Roth, welcome to the podcast.
Thank you so much. I'm so excited to be here and catch up with you. It's been a while since we last spoke.
Yes, and if you're not watching the visual, Robyn's shirt is incredible. She is the Boobie Doc. So your shirt, describe your shirt, Robyn.
So, I mean, it's cherries as boobs. I pretty much do everything as boobs. This one's from Target, but I also have my own boob line, the Shop the Boobie Docs, which I go all in on the boob stuff. So
We love the merch, and I'm sure you pun all day with the word breast. It's constant.
Oh my God. I mean, I do it as like I don't even think about it now. It's so second nature and it just like slips sometimes.
I love it.
I know I do it around my parents. I'm like, oh my God, I have to remember how to come speaking to.
That's okay. They know you do.
They know.
You have created
so
such a
weird
thing.
with my dad. Thank you. I have created such a thing. So I'm a breast radiologist and I started the Boobie Docs as a side fun thing just because I was missing writing and creating and I love it. And it's the timing is perfect because there's so much people are getting their health information from social media and there's so much misinformation out there, especially regarding breast cancer. So cue the Boobie Docs.
Absolutely. We're going to get into all that. Before, full disclosure, I've known Robyn for many, many years. She used to drive me to high school, which must have been so fun for you, driving 3 of your sister's friends to school every day. You must have wanted to fucking kill us.
How did I get like suckered into that? Like I was a senior in high school and everyone's like, oh, just swing by and pick up my daughter.
Yeah, just go around the entire neighborhood and just pick us all up and then take us. It must have been one of your greatest joys. Like finally you make it see you.
Did I wear like a little driver hat?
We should have. If only we would have known. We should have done merch, like the whole thing.
No, but look at us now.
Yes.
It's full circle.
Yes. Well, you were always someone who was like in journalism and you were super good at debate also, which is it lends itself so much to what you do now. So explain to me how we got into being a breast radiologist.
Yeah, so, it's funny because I really feel like the whole platform has made this whole thing full circle for me. So as Pam said, actually it's funny because my parents just brought up all my trophies from middle school and high school, and I have all these debate and journalism trophies. No athletics, all
honestly, you killed it. I did not. I would like read out of a notebook and be like, check it off the list. I attended this event, the end. You were like in it to win it.
Oh, I was in it to win it. Yeah, so it's funny because I thought I was going to go to college for journalism. And I went to University of Florida and I remember my dad at orientation being like, what are you going to do as a journalist? Like, are you the type that's going to go, be on site in these dangerous locations and interview people? Like, I'm actually pretty shy, or I used to be pretty shy. So, and when I thought about it, like what I was actually going to do with it as a career, it started to I was a little confused about what I was going to do long term. And I remember being at orientation at UF orientation, there were like hundreds of people in the audience. And we went to this pre-med orientation and they're basically like, raise your hand if you're pre-med, and everyone raises their hand. And I don't know why, but I raised my hand. And my dad looks at me. And the point of it was be like, you're all going to get weeded out. Like, you're probably not going to be a doctor. But my parents looked at me and they're like, you want to be a doctor? And I was like, growing up, I had growth hormone deficiency. I don't know if you remember that, but I was very short.
I did not know that.
Yeah. So I actually had to take shots all throughout my transformative middle school years, every single day. I would give it to myself. And now I'm a whopping 5'3", which is way taller than I would have been.
Okay, I strive for 5'3". I'm 5 feet tall and like not even a quarter of a half and a point inch above that. So like that to me, like you are Giselle. That's amazing.
Oh, I'm like the tallest woman in my family. My mom and my sister are both 5'1". So.
Love it.
But I remember like my relationship with my pediatric endocrinologist was so special, and she really helped me. And I was like, you know what, maybe I think I want to be a pediatric endocrinologist. And somehow I got through the pre-med at University of Florida, and I went to med school. I went to med school at Albert Einstein in New York, which was big for me because I had grown up and lived in Florida my whole life.
And we get stuck
And
here
when I got,
often.
yeah, like we got to
I'm
save
here. I'm
you,
stuck. I'm
right?
stuck. Yes. Someone come get me.
But exactly. So, but then when I was in med school, I found radiology because this is kind of a long-winded story, but it all makes sense in the end. I found radiology because I was very empathetic and I would take a lot of the patient stuff home for me, with me. So I knew I needed to be one step removed from patients, or so I thought. Um, and so that's why I chose radiology. And then during my residency, my cousins, I don't know if you know my older cousins, Melanie, Michelle,
I
they're
do.
about
Yep.
10, yeah. So they're about 10 to 12 years older than my sister and I, and we just adored them our whole lives. And while I was in, I don't know if it was, remember if it was med school or residency, Melanie, who was 32 at the time, found a lump in her breast. I was too young to really know what was going on, but she found a lump in her breast. She went to a radiologist. They said it's probably benign, probably a fibroadenoma. We're going to follow it in 6 months. And she said, I don't feel comfortable with that. I want to have it biopsied. And lo and behold, it was breast cancer. And she was 32, and this was 15 years ago, longer now. And genetic testing wasn't like the way it is now. And while she was like going through her treatment, she was going to get a lumpectomy. She was just going to focus on that one area. Her friend in New York had heard about this BRCA test. This was way before Angelina Jolie ever had her BRCA testing.
Yeah.
And she's like, I want to get this done. And they're like, it's probably not necessary, but let's just try it. And lo and behold, she was BRCA1 positive, which changed everything because now she had a greater than 50% lifetime risk of developing breast cancer in the other breast. So she ended up going bilateral mastectomy. And then her older sister, Michelle, who was probably 35 at the time, she goes and gets her first mammogram because now we know her sister's BRCA1 positive. She has breast cancer. She ends up being BRCA1 positive as well.
Oh my God.
So that was, thankfully, both of them are doing great. This was almost 20 years ago now. So it just shows you, thank God they were treated well. And, when caught early, breast cancer is a very treatable disease.
Yes.
But so they were in the back of my mind as wanting to help women like them. So once I found breast radiology as a career, I was like, this is for me. Like, this is my people. Um, and I love it and love what I do. And I get to help women every single day in the office and now on social media.
Yes, you do. And what you do is so important because you make it digestible and not as terrifying. And it's also something you've made it so that I see it every day. I think about it all the time.
Right.
You've also like put it in this pretty package. So thank you for that.
Thank you. My job here is done then because
Yeah.
like that's my whole point is I'm trying to make breast cancer, breast health less scary,
Yeah.
and hopefully and year round, like right, not just October, and also reaching a younger audience because we are unfortunately seeing younger and younger people being diagnosed with breast cancer. We know that about 50% of young people are getting their health information from social media. One third citing TikTok is like where they get their most health information.
Yes.
So it's really important that my content is really important, but also I try to make it fun so that it's not so scary. And hopefully we could be friends before breast cancer is ever a problem. But
That's
when
right.
it is, like, you're going to be like, I think the Boobie Docs talked about that. I think I should advocate a little
Yes.
harder.
And it's such a good name. So I do feel like so many more young people are getting it. And I question myself, I'm like, am I
Yeah.
just getting older and this is becoming more of a thing, or are the cancer rates rising?
Younger people are being diagnosed with all types of cancer more frequently, unfortunately. We see it in colon cancer, we see it in genitourinary cancer, but we also see it in breast cancer, unfortunately. So it used to be that breast cancer was an old person disease, mainly in people over the age of 60. And it wasn't something you had to worry about in your 20s and 30s. But unfortunately, like the latest data from the American Cancer Society shows that the numbers are actually declining in the over 60 population and they're increasing in the under 50 population with the highest rates. It's increasing about 1%, greater than 1% per year under the age of 45. But the greatest increase is actually in women in their 20s. And I'm not telling you this to scare you, but I'm telling you this so that anyone listening is more breast self aware because It's really important to know how your breasts normally look and feel like, get to know them, do a monthly self breast exam, because if there was any change, then you would really want to bring it to the attention of your doctor. And this is an important piece too, because I think that a lot of women are told that they're too young for breast cancer or it's just a cyst. And my platform is really always about continuing that conversation. How do you know it's just a clogged duct, or how do you know it's just a cyst? Is there any imaging test that we can do to exclude something more serious like breast cancer? Because it would really make me feel more confident.
Yeah.
My cousins, if they didn't advocate for themselves 20 years ago, we would be telling a very different story. So that's really the take home point of this conversation and pretty much my platform is to be your own breast advocate. You know your body breast. And yeah, 40, and we could talk, I know we're going to talk more about when to start mammograms,
Yes.
but before that, we need to have this conversation.
100%. And it can be scary, but it doesn't have to, it's not a death sentence. Like I feel like
It's
treatments have caught up
100%.
so much. So it's better to face it now than
Treatment.
to put it off.
Exactly. With early detection, survival rates of breast cancer approach greater than 95%. And even still, even if you're diagnosed with a later stage cancer, it's still very treatable and survivable. But obviously your treatment's going to look different, your long-term outcomes are going to look different. And we're trying to optimize your life after a breast cancer diagnosis because your life doesn't have to end because you had a breast cancer diagnosis. If anything, I think it's a new beginning and, your phase 2 of your life where you're thriving.
Yeah. Well, you touched on it a little bit before about the
Mm-hmm.
misinformation spreaders. I came
Mm-hmm.
upon one and I sent it to you. I'm like, oh my gosh, Robyn, you're like, I've been following this
Yeah.
doctor. I know that she's spreading misinformation. Have you ever approached one of these people that are on TikTok or Instagram that are saying these things to like say like,
All the
slow
time.
your roll? Yeah. So what did they
Yeah.
say back to you?
They really turn it around and they're like, you're just part of the problem, like you're part of the big pharma. I'm like, that is not how this works. If anything, they see that the people that are spreading this misinformation are usually trying to sell you something. In this case, there's a specific doctor that's in my backyard that has, she's trying to sell a new type of imaging test that is really not called QT imaging. I'm not going to give it much
Yes.
airtime because it doesn't require it shouldn't get any attention more than it already has gotten,
Yep.
but it's basically a fancy ultrasound. I'd be open to learning about it, and maybe it's a good, and it's really, it's deemed as a supplement to your mammogram. It's very early, there's not a lot of long-term research, but the way she's selling it is saying mammograms cause cancer. There's radiation in a mammogram, and radiation causes cancer, and therefore mammograms cause cancer. And that's really not a true statement. Um, and it's really fear mongering for personal gain or disinformation. Because in the same sentence, she's trying to sell you this QT imaging scan, which is not FDA approved to replace a mammogram, even when you go to her office. So it's not covered by insurance. You're going to pay $600 out of pocket. And I've had many patients come to me like, if it's abnormal, she's going to recommend a mammogram.
Yeah.
Um, and then they come to me and they're like, but I just paid $600 out of pocket for this test because, and now she's telling me I need a mammogram, and it doesn't like count towards your deductible. This is all out of pocket. And when you get there, you're going to sign all these waivers saying that this test is not approved to detect DCIS or early stage breast cancers. It is really a dangerous, social media is really dangerous. I've addressed her specifically. I've talked to her offline. Several of the breast radiology community has talked to her offline, and she's like, you should be willing to learn a bit, learn it. Like she wants us to read it. Like she would like me to read it,
Yeah.
Um, and she's making it like you should be more open to learning new technologies. And I am, like, I learn about new technologies all the time. Like if something came along better than a mammogram to detect breast cancer, for breast cancer screening the general public, I'm all in once we show data and prove that it could find the breast cancers that it's supposed to find. But without that, I'm not going to just jump ship at, but there are other exciting technologies I'm excited about, like contrast mammography. I think is great. Abbreviated MRI is a great supplement to a mammogram. But I think that the way that when you see some shocking information about breast cancer online, the first thing you need to do is go to the credentials of the person and make sure they're a doctor. And then what are they trying to sell you? This woman has bought a QT imaging scanner. She's opened up a fancy scanning,
Yep.
facility, and she makes money every time you come in for your QT imaging. And she's going to tell you to come back in 3 months. We're going to do a follow-up scan. If you're not picking up the picture, like,
It's
this
a
is a
money
scam.
grab. It's a money grab.
It's a
Yes,
money grab.
100%.
And I think it's really preying on vulnerable people who are, it's fear mongering. It's one, instilling fear about the screening tests that all their doctors are recommending. And then two, it's like a bait and switch. Okay, I see that breast cancer is a big industry, not for me, like, not for the person who's reading a mammogram. I don't make money when you get a
Right.
mammogram. Like, I'm right.
I'm not by
That's not how
commission.
this works.
Yeah.
Right. But it is how she's making money. So she sees that this is a industry that she used to be a breast surgeon until she jumped the shark. And
Yeah.
that's the scary thing.
Yeah, that's
So that's
terrifying.
all I'll say
And
about
money
that.
has
Yeah.
made this so difficult. So I'm so happy that you said the thing about looking at their credentials because that is huge.
Mm-hmm.
You sent me a bunch of myths on breast cancer, and I want to
Yeah.
debunk those because so
Yeah.
many things that you sent me, I was like, yep, I definitely have heard that, or I've thought that,
Yeah.
or I've wondered that. And the
Yeah.
first one you touched on before was that mammograms cause cancer. Debunk it for us, Dr. Robyn Roth.
Okay. So mammograms have a very small amount of radiation that we liken to, it's 3 millisieverts per view. That means nothing to you, but we liken it to about 7 weeks of background radiation. That's equivalent. But just to show you how minuscule the amount of radiation it is to your breast.
Mm-hmm.
Okay. And yes, the more radiation you have over your lifetime, like, it does add up. But the thing is, we are seeing, if that was the case, if it was the mammograms, then we would be seeing all these old people being diagnosed with breast cancer. And that's not what the numbers are showing. We're seeing people that have never had a mammogram or coming in for their first mammogram and they're having breast cancer. So it's not the mammogram. So stop spreading that misinformation. And the National Cancer Institute, which comprises of like 30 experts from different fields, they say that the small amount of radiation in a mammogram, the benefits far outweigh the risk of any radiation that you might get from a mammogram.
Okay,
So,
so there,
mic
debunked.
drop.
I love that. All of
Yeah.
the mic drop. I love all of those
I'm about to
points
drop
so
my mic.
much. Yes. Do you think though that the recommendations, because what is it? You were supposed to get your first one at 40. Do you think that goes far enough? Like, I feel like if so many more young people are getting it, does it take a long
Yeah.
time for the recommendation to change? Like,
Oh, yeah.
what
Well,
should we
I mean,
do?
so it is outdated, but we're never going to see it below 40 for average risk individuals. And this is really an important piece of conversation. So the recommendation, like, there are some societies that used to recommend 50. So
Yeah.
40 is like the bare minimum for average risk individuals. There are plenty of people that are average risk that are going to be diagnosed with breast cancer beforehand. And that's where the monthly self-breast exam and breast self-awareness really comes into play. But that recommendation is for average risk women. I personally would like to see it at 35, but that will never happen across the board. Okay, but there is a recommendation that says all women, especially Ashkenazi Jewish and Black women, should have a breast cancer risk assessment before the age of 30, ideally at age 25, so we can identify high-risk individuals that would benefit from earlier and supplemental imaging, extra imaging. So it's very easy to find out your breast cancer risk. There's an online tool called the Tyrer-Cuzick calculator. It's the one that we always see Olivia Munn talking about because this helped her find her breast cancer.
Wow.
The Tyrer-Cuzick calculator. We should link it in the show notes. Everyone should use
100%.
this.
Yes, we will.
You're gonna go on there and you're gonna enter it's gonna ask you questions. How old are you? How much do you weigh? When was your first period? Have you ever breastfed? Have you ever been pregnant? Type of thing. It's gonna ask about your family history. It's gonna ask about any known genetic mutations, and it's going to spit out a number. Okay, average risk for developing breast cancer is about 12.5%. So 1 in 8 people will develop invasive breast cancer over their lifetime.
Wow.
But if you start seeing, but that's average. If you start seeing numbers over 15, over 20% is considered high risk. These
Okay.
are the people that really need to meet with a breast specialist. and also consider genetic screening. I think everyone should consider genetic screening personally, but I think if you have over 15 to certainly over 20%, you should consider finding a breast specialist who would really talk to you about your personal risks. Running it with a doctor is always better than doing it yourself. So they can kind of verify those numbers and talk to you about early screening. So if you have greater than 20% lifetime risk of breast cancer, we would start mammograms. We would start breast MRI at age 25,
Wow.
and then
Okay.
add on a mammogram beginning at age 30, and then alternating every 6 months.
That makes so much more
So
sense to me. Yes.
that makes so much more sense. But the problem is that most people who are diagnosed with breast cancer are considered average risk and they have no known family history. So there's something going on, but this is the best tool we have right now to find people that may benefit from earlier breast cancer screening.
How do you find a breast specialist that is good?
Yeah, well, you're going to ask your friends
Hmm.
because I bet you someone, especially if you're in a city like, in South Florida or in New Jersey or in Southern New Jersey where I am. But if you find an academic center, there's usually a breast center nearby. So you're looking for, I think that there's lots of breast specialists, but usually a breast surgeon or a breast surgical oncologist is a great place to start for, to find the right person that you should meet with. So you can call their office. Some bigger institutions have a high risk breast clinic. That's where you'd really like to end up.
Yeah.
And so it really, I bet you in South Florida, I know that Miami Baptist has a good high risk breast center and great breast surgical oncologists. At my institution at Cooper in South Jersey, and then in Philly, there's a ton. But but a quick Google search can really help you find that.
Do you need a referral? Can you just call up and say, I want to assess my risk?
You probably do need a referral, but I guarantee you, if you ask your primary doctor, they're going to be happy to refer you out, because I think a lot of primary care doctors are a little scared and overwhelmed about these breast cancer recommendations, as they should be, because this is very nuanced. But they should be happy to give you a referral to go see someone at a high risk breast clinic. And in terms of genetic screening has gotten so much cheaper. I like to recommend J Screen. Um, it started as a Jewish cancer screening, but it's for all. You don't have to be Jewish to get screened. They offer screening for over 60 different cancer causing genes, not just BRCA1 and 2, but there's 60 of them, over 60, and it's constantly growing. But they offer that for, under $250.
Wow. What does the screening entail? Is it painful?
No, you spit in a vial, you send it out, and then you get results about a few weeks later, and they meet with you. You sit with a genetic counselor, you're going to have a virtual appointment. They're going to talk about what this means and your risk and what the recommendations are.
That's huge because
Mhm.
I mean, I've heard about BRCA obviously forever. I
Mhm.
have never gotten tested, and we were holding off
Mhm.
on getting testing, but I want to do it because I mean, I'm an Ashkenazic Jew. I feel like we have every weird
Mhm.
disease possible.
You should definitely do it.
We have to. We have to.
Yeah.
I also
I
want to
will
ask.
say, get life insurance before you get your genetic testing.
Oh, smart. Oh, good job. Yes.
Mhm.
These are the things I like literally need you to break it down for me like I'm a kindergartner and like be like,
Here
you
we
need to call
are.
this doctor and go here because it's a confusing world and we're lawyers in
Yeah.
our family. We don't have doctors. So I need to
Mhm.
hear this so badly. I want to ask you
So
because
you're all our
actually the
listeners.
group chat I'm in with your sister,
Mhm. Yeah.
we obviously talk about everything and we talk about having
Yeah.
to come back for after we get our first mammogram. They cordially invite us to come back for the second time because they
Mhm.
see something. I would have been so freaked out when I got called back because if I had not known that all my friends had, they literally were
Mhm.
like, we see something and we don't have an appointment for 3 months. And I would have been like, great,
Mhm.
I'll be dead by then. Awesome. So I found
Yeah.
out that it's much more common now that people are getting called back. Why is that happening?
Well, it's much more common to get called back from your first mammogram, number one. And the reason that is because one, we don't have comparison. So we're establishing what your breasts look like. And believe me, lots of people have things going on in their breasts. They might have cysts or fibroadenomas or other things. And then two, there's more knowledge. There's more knowledge about. You're more likely to have dense breast tissue if it's your first mammogram if you're young. And dense breast tissue, we have more knowledge about that now. That dense breast tissue makes it harder to see small masses on a mammogram alone. It also increases your breast cancer risk. It is in that risk calculator we talked about. So knowing that you have dense breast tissue is often, they might recommend supplemental imaging. So if you have dense breast tissue, we might recommend that you either get a supplemental ultrasound or MRI in addition to your mammogram so we could see through that dense breast tissue better. I don't know, like, were you specifically called back because you saw something or because you had dense breast tissue and they were saying,
I
like, we
think because
want to
I
see a
had
little bit
dense
better?
breast tissue, and I feel like that is such a common statement that I'm like, is
Yeah.
all breast tissue dense? Because I feel like I
Well,
hear that constantly.
if you're going to ask your 40-year-old friends, a lot of them are going to have dense breast tissue because about 50% of women overall have dense breast tissue. But in general, this is not true for everybody, but your breasts get less dense as you get older. But a lot of people, I still see people in their 80s and 90s that have dense breast tissue. So it's largely genetic. If your mom had dense breast tissue, you're more likely to have it as well. It's not a reason that you should be called back. What I say when and there's legislation that says, like, you're going to get a letter in the mail nationwide saying, like, if your breasts are dense or not dense. And if they're dense, they're going to say that dense breast tissue increases your risk of developing breast cancer and makes it harder to find small breast cancers. By adding an ultrasound or MRI, we're able to find smaller breast cancers at a more treatable stage. Talk to your doctor, if supplemental imaging is right for you.
Okay.
Um, so it is something that, unfortunately, like, it's not technically a callback, but it's something that you're going to get information about, and it's going to make it seem like it's not a good test, but it is a good test. Like, we could still see lots in women with dense breast tissue. It's certain, but I have seen cases where there's a large breast cancer, they have dense breast tissue, and you really cannot see it. And that's where the supplemental imaging comes into play. So I always tell people, if you want to find your breast cancer at the earliest, most treatable stage, and you have dense breast tissue, add an ultrasound or MRI depending on your risk factors.
I love that. So, would you say
Yeah.
just because for me, I'm like, why are we playing this game if I'm going to have to come back anyways? And also, I'm here to begin with. I just want to
Mm-hmm.
find out what's in there. Should I be
Yeah.
advocating for an ultrasound every time I get a mammogram?
I think so, personally. And there are places where you can get it done at the same time. My institution, you can, if scheduled appropriately, you can get them done at the same time. That's ideal. Sometimes people like to stagger them. So you get a mammogram in January, and then 6 months later, you get an ultrasound or MRI. It depends on a personal choice. Sometimes it's really about scheduling, but I wouldn't say that, that's getting called back. And I actually do want you asked a good question. You said, is everyone getting called back? So I want to talk about that for a second, because by law, about 10% of we can call back about 10% of people. We get audited as a breast radiologist. Our callback rates are how many biopsies we recommend, things like that. So 10% of women will typically get called back from their mammogram. And I like to say it like this. So let's say 100 women go in for a mammogram. 10 of them will get called back from their mammogram. Of those 10 women that come back for their diagnostic workup, 6 of them, so 60% of the people that are called back, will be told everything is fine. It was just overlapping breast tissue,
Hmm.
it's just a cyst. 2 of them will be told it's probably benign. And that could be a scary place to be, I understand. So that means that it's a less than 2% chance of that being cancer. We typically follow you every 6 months for 2 years until we prove that it's not changing, and then we bless it. Um, and then another 2 of those women, out of the 10 women that get called back, will be recommended to have a biopsy. Okay, so 2 out of the 100 women in the end will need a biopsy. And of the 2 biopsies we do, 80% of them are benign.
Wow. Okay. That's such good news.
So it's the odds are in your favor, but
Yeah.
certainly the ones that get breast cancer, it really hurts because most likely it's nothing, but a lot of times it is something, and that's why you just have to go to a place where you could trust, where you trust the radiologist, and be up to date on your breast cancer screening.
Yes. What do we do about if we are anxious about getting mammograms or getting any type of screening or testing, or we
Mhm.
have a friend is, how do you coach people through that?
Well, that's called anxiety, and that's a real thing. So the anxiety you might feel after, getting an imaging test. I would tell people that, early detection is the breast protection. It's going to offer you more treatment outcomes. And so even if this is breast cancer, we're going to find it early. Like, that's the whole point of, getting a mammogram every year, coming back for your supplemental screening. So we could really get a good look at your breast. So I would say, denial is not in your favor. It doesn't make it go away. If anything, it just gives it more time to grow. So I think that, you have to put on your big girl panties and just go see what the results are. Most likely, the numbers like we talked about are in your favor. But I also think that unfortunately, if you do need a biopsy and it is suspicious for breast cancer, just rest assured that there are lots of treatment options. You know, breast cancer, even if it is far along, there are new and emerging treatment options all the time. And so I would say, just, you've got to find out what's going on and so we could treat it appropriately.
Absolutely. And science is catching up to us so much. I want to ask
Yes.
you about deodorant. One, you're not supposed to wear deodorant before you get screened. Why is that?
So that's a great question. So deodorant actually, because you know how it leaves that white residue on
Yeah.
your armpit? Well, that actually could look like the calcifications that we're looking for on a mammogram. So that's why we say not to put it on before a mammogram. But let me be clear that deodorant does not cause breast cancer.
Yes. Okay.
Okay, because that is a myth that goes online. It has some. If you're really worried about that, then you could use some aluminum-free deodorants. I personally use a regular deodorant because I just don't think the other ones work as well.
Yes.
And I know that there's no really long-term data to suggest that deodorant causes breast
That's
cancer.
huge because that has been the
Hmm.
first thing that anyone that's going on a holistic or more clean life
Hmm.
journey, they're like, get rid of your deodorant. It's going to kill
Hmm.
you. And no, they don't work as well. They just don't.
Yeah,
I
they
use
just
one
don't.
without aluminum and I suffer. So, yes.
I think at the end of the day, you have to pick your poison, if you
Yes.
will,
Yes.
because there are environmental things in and out of our control all over the place. So wherever you can control it and you feel like it's worth it for you, then certainly by all means reduce that thing. So but alcohol's a big one. Alcohol is one of the biggest, unfortunately, one of the biggest carcinogens that we know, and it's so widely accepted, but and I love a good drink here and there. But I also know that, like, yeah, this could potentially increase my breast cancer risk. But I'm also really diligent about getting my breast cancer screening. I know that I would catch it early if I ever do develop breast cancer, which honestly, like, I feel, unfortunately, like in my lifetime, I probably will develop breast cancer. I think that's just, I've come to the realization that most people I know and love may develop breast cancer during their lifetime, even though the numbers are, 1 in 8. But I don't know why I feel like it's all the people that I know and love. So that's where being up to date on your cancer screening, being diligent at any changes in your breast, that's where that comes into play.
When is it not crazy to get screening in terms of like how many times? Because like when I hear this, I'm like, I would like to go weekly. I'm obviously not going to do that. That's crazy, but I'm
Don't do that.
extreme. So
Yeah.
what is like not a crazy number, I guess?
Well, I mean, I think that like once or twice a year is probably what is widely accepted.
Okay.
Meaning, like, if you get your mammogram, like, you might be the type that might want to stagger your breast cancer screening, because you might want to get a mammogram in January and then 6 months later, if someone's high risk, we usually do that. We give them a mammogram in January, an MRI in June. That way we're never going 6 months without any type of breast cancer screening.
Okay.
But in the meantime, you're going to do a monthly self breast exam. You're going to you're going to pay attention to any changes in your breasts. And if they're getting larger or they're persistent, or you just know that something's off, go get it checked out by a breast specialist. Then they would order something called a diagnostic mammogram and ultrasound. And that is different than your annual screening. Screening is for the asymptomatic population. So that's where the monthly self breast exam, that's where that comes into play. And it's not, you could do it more than once a month. Like, you could just know how your breasts feel at all times. Your breasts are bumpy throughout the month. Like, right after your period, they're gonna, like, as you get your period, they're gonna get bigger. You might feel lumps that you never felt. That's the dense breast tissue. But after your period, they should go down, they should fluctuate. But if you do your breast exam, then you're gonna just know how, oh, that's just my breast after my period. Like, that's my breast during my period. So I don't think there's never too much time to check your breasts. But in terms of imaging, that we want to limit. Like, I wouldn't do more than a mammogram a year. Because, like we said, they do have a small amount of radiation. You only want to do when it's necessary, but you could certainly, do a self breast exam. Has nothing, it doesn't
Right.
cost anything. It's free, has no radiation. And, then that's how you're going to find any of the interval cancers or things that are going to pop up in between your exams.
What does a lump feel like? Is it hard? Is it soft? Is it just both?
You know, it's the ones that we worry about are typically hard. They're typically not mobile. They get bigger, they get harder. they just, they don't go away after your period. Those are the ones you really want to pay attention to. And those are the ones you have to go see your doctor immediately, even if you just had a normal mammogram, because like we said, mammograms are not perfect, especially if you have dense breast tissue. And we would do more targeted testing for that specific lump if you found something. We would definitely do a diagnostic ultrasound where the radiologist, you meet with me, we put a probe on, and we just say, oh, it's just dense breast tissue. Then we could confidently say that's nothing, or there's a mass there that needs a biopsy, or maybe we'll follow it, or it's a conversation. That's, so I would say that, the ones that are getting bigger, harder, not going away, or fluctuating with your period, those are the ones we really have to be worried about.
Okay. Does
But
size
again, if you feel a lump that doesn't feel right to you, bring it to your attention of your doctor, let them do a proper physical exam, and then really push to get it imaged with an ultrasound, or a diagnostic mammogram.
Yeah, self advocating seems like it's the
Mm-hmm.
most important thing above all else. Does
Absolutely.
size matter when it comes to breast cancer in terms of the size of your boobs?
It doesn't matter. It really is more about the composition of your breast. Like I said, if you have dense breast tissue, like dense breast tissue is what I consider the active, hormonally sensitive tissue in your breast. So fat, breasts are composed of fat and then dense breast tissue. The more dense breast tissue you have, the more active your breasts are. And those are the patients that's where the breast cancer is going to form, in this dense breast tissue usually. And that's why it's so important to get a good look beneath the dense breast tissue, because we know, I always say it's like a double-edged sword. It increases your risk and it makes it harder to see.
Yeah. I want to ask you about men. So I know that
Hmm.
men get breast cancer as well. As
Yep.
a boy mom, if you have a family history, or even if you don't, should men be checking their breasts? Like, how does this get discovered in men?
It is self-exam, and then I think that a breast cancer, if you start having family history, usually when we talk about family history, the most important risk factors would be a first or second degree relative, especially if they had a young breast cancer. So age of diagnosis matters as well. But if you actually have a family history of a man in your family being diagnosed with breast cancer, that's a very strong risk factor. I can almost guarantee that you're going to be high risk. But I think getting to know your breast for men too, they should consider genetic testing as well, because men can get BRCA mutations. And if you're a BRCA positive man, we do screen some men with mammograms that are BRCA positive. That's a more nuanced conversation, but there are some places that would screen men, every year or two, beginning at age 50, if they have a BRCA, a genetic mutation that increases the risk. And certainly physical exam, self-awareness, key. That's how they're going to find it.
I feel like that is never talked about when it comes to men. Like, I've never even
Yeah.
heard that. What obviously it's so important. They worry about prostate cancer as much more.
Mhm.
Why is that? Why is there no really public information about that?
Well, it's much more rare. Men account for about 1% of breast cancer cases, but that 1%, for those, it's like over 800 men a year. It's much later. Like, it's not going to be like your 12-year-old son being diagnosed with breast cancer that I know of. Never seen that.
Knock
But
on
it's
every
more
piece of
like,
wood
yeah,
in this
right,
studio.
knock on every
Yes.
piece of wood. But it's more, as you get older. I've seen more and more younger men getting diagnosed with breast cancer though, but it's still like late 30s. Beyonce's dad had breast cancer. Did you know that?
I
And he
did
was
not know
BRCA2
that.
positive.
That's
Yeah.
huge. I
So,
mean,
yeah.
it happened once Olivia Munn got it, like everyone was talking about it again. I feel like every time,
Mm,
unfortunately, we are so celebrity driven as a culture. So that's
yeah.
another way that we're getting all of our information is by following the lifestyle of celebrities. So that is very important
Yeah.
news. So thank you so
I
much.
think it's really important. And I love this. I love pop culture as well. I
Oh,
don't know
so
if you know
much.
this, but
Yes.
like, I know. Um, so anytime a celebrity is diagnosed with breast cancer, it's really important. And it's so impactful for the people out there that are like, that look up to them. They're like, if they can get it, maybe I could get it too. And, Olivia Munn was really important because she talked about, if you're not familiar with her story, she had a normal mammogram. She is 40 something, 42 or 3, and her doctor was like, maybe we should just do that online test that I told you about to find out your breast cancer risk, which honestly should have been done probably 20 years ago, but this is a newer recommendation, so I understand why it wasn't done. But she was found to have a greater than 38% chance of developing breast cancer over her lifetime, which we talked about. Over 20 is high risk. She was very high risk. And so she got an MRI, and on that MRI, they found bilateral breast cancer.
It is so insane.
after a normal mammogram. But it's so important, and like Katie Thurston from The Bachelor, I'm a big Bachelor fan.
Yep.
She was diagnosed with breast cancer in her 30s. She found a lump, and so when celebrities share these stories and are willing to be open and vulnerable about it, it really allows the general population to kind of hear this information that I'm out here spouting all day long, but no one's going to hear it. But when they hear it, when they have the story to tell, it's very important and impactful.
So true. And it all goes back to like knowledge is power and hearing about this,
Mm-hmm.
which is why everyone should follow you and follow your recommendations because you are
Thank
you
you.
are such an amazing source. I want to go
Thank
back
you.
to another myth is that following
Mm-hmm.
certain diets reduces your chance of getting breast cancer. True or false?
So, well, true reduces your risk of developing breast cancer, but it cannot prevent developing breast cancer. And
Okay.
this is that I actually hate the word prevent, and some people use it pretty loosely. To me, prevent means you're not going to get it.
Yeah.
And whenever I see people like follow this diet and it will prevent developing breast cancer, I'm like, is there like a money back guarantee? Because I
Right.
can almost guarantee you, because but there are certain things that we can do to lower our risk of developing breast cancer. And this is what we call modifiable risk factors. So let's talk about some of those. So eating a green diet, a plant-forward diet that minimizes processed food, that is going to go a long way. Okay. And it's lowering alcohol, limiting alcohol as much as you can. Like even there are studies that show even one drink a day or a week can increase your risk. So there's no safe amount. But this is where I think that moderation and weighing the risk and benefits of what's important to you goes into play. But minimizing alcohol, minimizing smoking, exercising, eating a healthy plant-forward diet that minimizes processed foods and red meats, that's going to go a long way. Also, keeping a normal vitamin D level, that's a good one too. But
Yes.
like I said, you can, even if you did everything right,
It could still
like there
happen.
are still people that develop breast cancer. So that's why I say it doesn't prevent it. Yes, it can lower your risk, but there's no money back guarantee that you're not going to develop breast cancer, unfortunately, because there are lots of environmental factors that are out of our control. The microplastics in our packaging, in our water bottles, all these things that we are exposed to all the time. Even if
Yes.
you were perfectly clean all the time, you're still exposed,
It's
unfortunately.
impossible. And if you are perfectly clean, you're probably going insane anyways. So none of it's worth it. I
Right.
also want to say, because I will hear from friends like, oh, well, my grandmother ate this and this crap and they were fine. They lived to be so old.
Yeah.
We have so much more in our environment and in our
Yeah.
world that they never had. Is that true?
Yeah, I mean, like I don't know what it is that's causing all these young people to develop breast cancer. I think it's a combination of multiple things. One, we're more sedentary. Two, vaping is more accessible. Alcohol is more glamorized. We, as a society, like I don't know what we're doing wrong, but there's something going on. There's something in the water,
Yes.
um,
Literally. Yes.
literally. So, which is why, to me, it all comes back to early detection. And so I always say early detection is the breast protection because you could do everything right and still develop breast cancer. And that's why, screening is so important and breast self awareness is key.
Robyn, you have cleared up so many misconceptions and given
Thank
me
you.
such good information. I encourage people to follow you. Give me like your 5 top tips of like take homes.
Take home a point would be find out your breast cancer risk using that online calculator, the Tybor-Cuzick calculator that we spoke about. If you have greater than a 20% lifetime risk of breast cancer, you definitely want to start breast cancer screening earlier and more often. Like I said, we might start MRI as early as age 25 and add on a mammogram beginning at age 30. A good rule of thumb for that is about 10 years before a first degree relative that was diagnosed with breast cancer. So that's number one. And then, if you have a high risk or intermediate to high risk, I would really consider genetic testing and finding a high risk breast clinic near you.
Mm-hmm.
So that's number one. Number two, stay on top of your breast cancer screening. Like I said, early detection is the breast protection. If you have dense breast tissue, you might want to consider adding an ultrasound or an MRI, depending on your risk factors. Um, and three, minimize. Wait, what was the third thing? Oh. I'm so bad at lists.
Monthly self-exams we talked about.
Monthly self-breast exam. Yes. Number 3 would be a monthly self-breast exam. Get to know how your breasts normally look and feel so you could recognize a change, especially if you're below that screening age or you're a male and you're not in that, in that screening population. I think that's really important.
And I want to add a fourth. Follow you. What is your handle? And if people have questions, can they DM you?
My DMs are wide open. You can follow me at the Boobie Docs for more of the breast information. Obviously.
Yes.
I also have a podcast, The Girlfriend's Guide to Breast Cancer, if you want to delve more into this. We have lots of good conversations. I speak to breast cancer experts, breast cancer thrivers, so people who've had breast cancer, also previvers. If you've never heard that word, you've heard it here first. It is someone who's an elevated lifetime risk for breast cancer because they might have a genetic mutation. So we delve into all those types of things on my podcast.
You are amazing, and you are saving lives, Robyn. Thank you so much for being here. You are such a light, and I will, of course, share everything in the show notes. And I have homework to do, so I got to go.
We all have homework to do.
Yes, we do.
Thank you so much for having me. But first, can we take a selfie?
Of course. Selfie. Yes. Yes.
Oh, this one's for my sister.
Oh, Brooke.
Ready? Say Brookie.
I love it.
Which my parents are here. Their flight, they were supposed to go home. Well, Brooke was here this past weekend, and my parents were also here. And their flight has gotten canceled 2 days in a row. So they live here now.
That's horrendous. I mean, but amazing for you, actually. No, if it had to be one way, let it be that way. Yes. Yeah, that's true. That's true too. Well, Robyn, thank you so much for being here. And thank you all for listening. I'll see you in the next one. Thank you so much for listening to this episode of Shut Up, Tell Me More. You can find us on Instagram at Shut Up, Tell Me More. Remember to subscribe to the podcast. If you listen on Apple Podcasts, go to the show page and click the follow plus sign. If you listen on Spotify, click the follow button. You can also find us on YouTube. You'll automatically receive new episodes as they come out, as well as updates. Doing this also helps me algorithm land, so thanks in advance. Lastly, give me a 5-star review, and I'll be so grateful. See you in the next one.